Tay Sachs disease?
Tay Sachs disease is a rare inherited disorder. It causes too much of a fatty substance to build up in the brain. This buildup destroys nerve cells, causing mental and physical problems. Infants with Tay Sachs disease appear to develop normally for the few months of life. Then mental and physical abilities decline. The child becomes blind, deaf, and unable to swallow. Muscles begin to waste away, and paralysis sets in. Even with the best of care, children with Tay Sachs disease usually die by age 4.
How do people get the disorder? If one or both parents is a carrier, there is a 50% 1 in 2 chance that each child of theirs will also be a carrier. A child who inherited 2 copies of a faulty gene, one from each parent, will have Tay Sachs disease. If both parents are carriers, there is a 25% in 1 in 4 chance of this happening September 10th, 2010.
Symptoms. Examples: muscle twitch, muscle weakness, problems with coordination, stiff muscles, difficulties swallowing.
Treatment. There is no cure for Tay Sachs disease, but the patients are treated very carefully. One doctor from each symptom. For example, specialist neurologist treats nervous system disorders. Pediatrician provides medical care for infants, children, and teenagers. Medical genetics diagnosis and manages heredity disorders. Ophthalmologist specializes in eye disease.
This is Nathan Parney. He's a little boy who has been diagnosed with Tay Sachs. You will learn more about him in the next chapter.
Basically what this is it forces air and medicine into his lungs and breaks up any mucus that may be building up so that he can cough it out and prevents pneumonia and all that. So Catherine and I got married about 5 years ago. Wanted to start having a family and got very excited. We got pregnant with Nathan. You know, you grab your fingers, do all the happy little things that babies do.
We had a friend who had a child who was 2 months younger than Nathan, and that was the biggest difference for us, is all of a sudden this little boy who was 2 months younger than Nathan started passing him up. He had, speech therapy and occupational therapy and physical therapy, trying to get his skills up, trying to get him to hold his own bottle.
I remember I was at work and got the phone call.
I called Aaron and we kind of just, for me it was a lot of denial at first because I thought absolutely not possible. At the moment, there's not a future. There's never been a child who's ever survived Tay Sachs.
Tay Sachs disease is a neurodegenerative disease, and in the infantile form, which is really the worst form, the babies are born looking healthy, and within the first 6 months, they lose skills that they have gained and just continue to deteriorate. Once you make the diagnosis, you're basically telling the parents your child is going to deteriorate and die within the next few years. In our genetics division, we do a number of things, including pediatric genetics. And I saw a patient who had Tay Sachs disease, and he was not Jewish. And when I asked other physicians if they could guess what his nationality was, nobody would guess that he was Irish. And that provoked thoughts that perhaps we need to get more information out into the community of physicians and the Irish population about the increased risk of Tay Sachs disease in the Irish population. Now that we have the ability to sequence the gene, we can also identify specific mutations or alterations in the gene and hopefully come up with guideline for screening people of Irish descent with a carrier rate and specific mutations that can be looked at in that population.
It doesn't matter how small the number is when you're that number. All the odds kind of go out the window. So it was very important to us to not have this happen again.
What we want to do is to raise awareness about the Irish and come up with a guideline if the carrier rate is sufficiently high. This is a job that is a big job, to educate people, both the medical and lay community, and to actually document clearly and scientifically the carrier rate, publish it so that it is out there and people know about it.
If we can prevent this, which it's completely preventable if you're tested, you won't have a child who suffers. You won't have a family who has to go through what we're experiencing.
We want Nathan to have a legacy.
Three interesting facts about Tay Sachs. People with Tay Sachs also have cherry red spots in their eyes. Number 2, both parents must carry the mutated gene in order to have an affected child. In these instances, there is a 25% chance with each pregnancy that the child will be affected with Tay Sachs disease. Prenatal diagnosis is available if desired. The incidence of Tay Sachs is particularly high among people of Eastern European and Ashkenazi Jewish descent.
Summary/conclusion. There is no cure for Tay Sachs. Since this disease has no cure, your muscle weakens and makes it hard to do things.
Resources: MedlinePlus.com, Mayo Clinic and others, Genome.gov, BrainFacts.org, YouTube.com.